Dr. Soto.
Hey, Amy.
Why do you think it's so important to view your plastic surgery as an experience as opposed to just a purchase or something that you're doing to enhance your body?
Oh, that's a very important point. There's a few things to talk about. First of all, it is important just right from the get-go to understand that when you engage in a relationship with a plastic surgeon, and for the purposes of answering your question, I'm going to assume that we're talking about a board-certified, ethical, responsible plastic surgeon. It's different than purchasing a product, right? What you're really buying is a professional service. It's no different than hiring an attorney. The attorney wouldn't be able to guarantee you an outcome. What you're getting when you hire an attorney is you're getting hopefully their best effort on your behalf. And what we do is no different. When you engage in a relationship with a board-certified plastic surgeon, hopefully what you're getting is their best judgment, their skill, their experience, all brought to bear on your behalf. And so I think that it's important to understand that it's much different than buying a product. When you're buying a product, any product, say you're shopping for a curling iron or a toaster or something, it makes sense as long as you know that the product is the same at store A and store B to shop for the best price, right? Even if the customer service experience at one store may not be as good as at the other, especially in this day and age, it makes sense to shop for the best price. That's a lot different, though, than what you're dealing with when you talk about a professional service like a plastic surgeon or an attorney or an architect, because you're not necessarily getting the same product when you get that lower price. There are many ways to cut corners in healthcare and in surgery, and some of those ways may not mean a difference to your safety or outcome, but then again, some of them might. And so I would have to wonder sometimes about cut rate plastic surgery. It's important to understand that it's your safety on the line, really. We're talking about surgery. As far as the experience goes, I think that that's really important to understand too. It's not as though you're going through a drive-through window, throwing some money at a teenager, getting your food, and then driving off. When you have plastic surgery, the relationship you have with your surgeon is critical, not only to your outcome, but also to your experience and how you feel about it and how you remember the experience. It should be a very positive experience that helps your life and that enriches your life and that you can look back on very fondly and hopefully recommend to your friends and at no point feel uncomfortable or creepy or definitely unsafe. And so, what I always advise people is that the important decisions to be made in assuring that you have that kind of an experience all start when you very first start to think about it. So most young women, when they're first thinking about having any kind of a plastic surgery procedure, start where most of us start when we're looking for anything on the internet. And that's a great place to start. There's nothing wrong with that. And I think that the internet has done wonders for our ability to learn about everything. So I think that learning about the procedure, learning about the options, learning about the pros and cons of those options on the internet, I think all of that is fantastic. What I would advise against, however, is making up your mind too early. Just because something worked for a friend or something worked for somebody you met on the internet or you read a few things on the internet that make you think that this implant or that technique might be the best for you, it doesn't mean that it really is the best for you. So I think that starting on the internet, gathering some information, all of that's great. Just be careful not to let yourself make up your mind until you've met with an ethical, responsible, board-certified plastic surgeon to give you the perspective that you need to make the decisions that are best for you. Once you've done that basic research on the procedure that you think you're interested in, and you think, okay, after doing that reading, this is something I might want to do, then I think it's appropriate to start doing a little homework on who you might want to do it. I meet a lot of young women on the internet, and a lot of young women send me emails, and from these emails and interactions, I've gotten the impression that too many people are going about it really the wrong way. And they're researching the surgery way too much, the details of the operation way too much, and they're making up their mind what they think they want as far as the operative technique and how they want the surgery done, and then they're going shopping for a surgeon who's willing to do that for them at the right price. I really think that that's a mistake, and I think that's part of why I do see some unhappy women after they've had surgery in other places. I think the better way to go about it is what I was saying. You do the research on the procedure and what your outcomes might be and what other people's experiences have been. Then the second step would be to do some research on who might do it for you. And I would locate 2 or 3 board-certified, ethical, responsible plastic surgeons and do a little homework on them. Find out where they went to school, find out where they did their training, understanding that not all schools are equivalent, not all training programs are equivalent. Some of them are better than others, and that's why we all fight so hard for those SAT scores and such. And so you want to do a little homework on where they went to school, where they did their training, what their experience is, what their level of expertise is, what are other patients saying about them, what are their outcomes like. Most plastic surgeons do have photos of their outcomes available online, and you want to look at those critically. Should you expect every one of their outcomes to be perfect or exactly what you want? Absolutely not. That's not reasonable because everybody's body is shaped a little bit differently. And what you might not find attractive might be exactly what the patient in the photo wanted. And so those before and after pictures don't tell you how happy or unhappy the patient in the picture is. On the other hand, there might be a picture that you think is beautiful and perfect for you, and what you can't tell from the picture is that the patient in the photo is actually unhappy with it. So you have to take all of this information with a little bit of a grain of salt. And the same thing is true with online reviews. There's something that goes on when you're able to complain about somebody anonymously. People can sometimes be a little irresponsible. So I wouldn't pay too much attention if you find a doctor that you think is otherwise great for you, but you read that he has 1 or 2 bad reviews. That wouldn't bother me as long as the majority of the reviews were positive and people thought he was a great doctor. It's really the pattern that you're looking for, and the same thing is true with the before and after photos. You want to look at the overall quality of the work. There might be one photo that you think, oh, that doesn't look as good as I would want it to, but if the rest of the photos, the majority of the photos look like he's a quality surgeon and he really has a good eye for beauty, then I think for the most part you can be confident that you'd be in good hands. Once you've identified 2 or 3 surgeons that have the right credentials, that are board-certified plastic surgeons, that have an overall pattern of safety and happy patients and a pattern of excellent outcomes from their plastic surgery, call and schedule a few consultations. I would visit a couple. It's possible that the first one you meet just knocks you off your feet and you love him and you think that you're going to get along great and he really understands your goals. And if that really is the case, then I don't think it's necessary to go and meet with a couple of others. But I think that it is important to at least consider meeting with a few surgeons and seeing who you feel you're going to get along with the best. The important thing to understand is that it is a relationship, and it is an important relationship that you should take very seriously. There's a give and take in the relationship, just like any other relationship that's important. So you want to find somebody that you can communicate with comfortably, somebody that you feel listens to you, somebody that you think is honest with you about what they think they can do and how they think they can do it and what the risks of doing it might be. You want to feel that you're in the hands of somebody that you can trust. And once you've found somebody that you like and you feel you can trust, then at that point it would be acceptable to go ahead and consider proceeding.
Okay. Well, yes, this is a big decision that patients are making, so it is very important that they trust the hands that they're putting themselves in. So thank you, Dr. Soto, so much for your advice, and we will see you next time.
Okay. Thanks, Amy.
Thank you.